Hi, my name is Jerald Cherian, and I'm a fourth-year Clinical and Research Infectious Diseases Fellow at the Johns Hopkins University School of Medicine. My project for the Shea Epi competition is titled, An Electronic Approach to Identify Unnecessary Vancomycin Prescriptions. IV vancomycin is now among the most frequently prescribed antibiotics in the inpatient setting. However, prior studies have shown that 20 to 70% of vancomycin prescriptions are likely unnecessary. The overuse of IV vancomycin is problematic since vancomycin can cause harm. Vancomycin-associated nephrotoxicity is a common adverse event, with up to 43% of patients receiving vancomycin developing acute kidney injury. Additionally, overuse of vancomycin has been shown to promote antimicrobial resistance, as increased use is associated with increased rates of vancomycin-resistant enterococci. Such adverse events contribute to excess healthcare costs, as does the need for intensive drug monitoring. Given these harms, it is necessary for antimicrobial stewardship programs to identify unnecessary vancomycin prescriptions. However, currently identification relies on manual chart review, which is time-consuming and resource-intensive. Electronic health record data can potentially be used to identify unnecessary prescriptions in a systematic and reproducible manner that is less resource-intensive. However, automated electronic methods of identifying unnecessary vancomycin prescriptions have not previously been well explored. Thus, the objective of this study is to develop and validate electronic methods to accurately identify unnecessary vancomycin prescriptions using structured EHR data. We plan to complete this objective through two aims. First, we will develop and validate a rule-based electronic algorithm to identify unnecessary vancomycin prescriptions. In aim 2, we will then develop and validate supervised machine learning models to identify unnecessary vancomycin prescriptions. Both aims of this study will use the same study population, which is a retrospective cohort of adult and pediatric patients who were admitted to a Johns Hopkins Health System hospital from 2020 to 2023 and received at least one dose of IV vancomycin. In aim 1, we will chart review 400 courses of IV vancomycin to assess appropriateness. Each course of therapy will be classified as necessary or unnecessary based on an adapted version of a framework developed by McGill et al., which is depicted on the right. We will then develop a rule-based classification algorithm in SQL, emulating the structure of the McGill et al. Framework using structured data elements noted in the table on the right. The algorithm will then be used to classify the 400 cases that were previously chart reviewed as necessary or unnecessary. We will evaluate the performance of the electronic algorithm compared to chart review using metrics such as percent agreement, the kappa statistic, sensitivity, and specificity. In aim 2, we will develop a tree-based supervised machine learning model to classify courses of IV vancomycin. We will explore the use of at least two different types of models, including random forests and extreme gradient boosted trees. When developing the models, we will use 400 cases that were chart reviewed in aim 1 as a labeled dataset for model training and validation. The same structured data from aim 1 will be used as dependent variables. The classification outcome for the models will be whether the course of vancomycin was necessary or unnecessary. The models will then be internally validated using k-fold cross-validation. During validation, metrics such as area under the receiver operating curve, calibration plots, and sensitivity and specificity will be used to evaluate model performance. Our research group has previously developed a rule-based system to identify vancomycin-associated kidney injury using structured EHR data. This demonstrates the feasibility of developing a similar system to identify unnecessary vancomycin prescriptions for this proposed study. Completion of this study would provide ASPs with a new electronic tool to assist them with operational activities. It would not only facilitate tracking of unnecessary vancomycin prescriptions, but also offer data that can be used to provide feedback to frontline clinicians during ASP interventions. Furthermore, the data regarding unnecessary vancomycin use can potentially serve as a metric to evaluate the impact of ASP interventions. After completion of the study, we plan to externally validate the algorithms at another healthcare institution. We also plan to conduct a quasi-experimental study evaluating the impact of monthly clinician-level feedback reports regarding unnecessary vancomycin use on vancomycin prescribing practices. We also eventually plan to create similar electronic methods to assess appropriateness of other antimicrobials using EHR data. To complete the proposed work, I will continue to work under the mentorship of Dr. Sarah Cosgrove and Dr. Ailey Klein, who have served as my mentors during fellowship. Their expertise in antimicrobial stewardship and data science will ensure successful completion of the proposed study. Thank you for listening.